Assalamualaikum to Miss Farah Basri. My name is Nursyazwani binti Zubair and my metric number is 200848.
My name is Nurul Izzati binti Razman and my metric number is 200708.
So today we will talk about the ways to deal with mental health problem. So what is mental health problem? Mental health problem refers to a wide range of mental health condition disorder that affect your mood, thinking, and behavior. Example of mental illness include depression, anxiety disorder, eating disorder, and addictive behaviors. Individuals who have a mental illness consist of particular cluster of symptoms. This symptom typically consists of a combination of abnormal thought and bodily sensation, usually called as cognitive and somatic symptoms. For example, in mental illness of depression, the cognitive symptoms include thought of God, worthlessness, and hopelessness, whereas the somatic symptoms include loss of energy, sleep, and appetite disturbance. So there are another symptom too, like sweating, collapsing, and others. So if you have this symptom, there are a few ways to deal with mental health problem, include ask for help, professional help, and involved in physical therapy. So let's take a look at the first point, which is asking for help, professional help. For example, like counselor, psychotherapists, and others. So they could help us to deal with this problem by clinical interview or psychotherapy with them. Psychotherapy usually include that there are an interaction between a professional and a patient so that we can express our problems and anxieties to them. Psychotherapy can help eliminate or control troubling symptoms so a person can function better and increase well-being and healing. If the help professional providing a safe, accepting, and therapeutic environment, it is a good way for client to feel that somebody cares and keeps their interest at heart. In this respect, the client can come into therapy again and tell the clinician about their concerns so that the clinician can find a way on how to help them. Other than that, the health professional could help to suggest pharmacological treatment, which it is a term for using medication to treat disease. These medications are selected to treat specific symptoms. Their purpose is to relieve the symptom and provide better brain health. This process usually takes at least 4 to 6 weeks before they are able to improve communication system in brain. In order to obtain maximum relief for the symptom, the patient must take the medication as prescribed by the doctor, and the doctor could explain the possible side effect of taking the medicine. So valproic acid is one of the examples that have been selected by the WHO for the treatment of the mental health problem. So now let's move on to the next point, which is involved in physical therapy.
Thank you, Shazwani. Now I will continue the presentation. So, as Shazwani said just now, the next way to deal with mental health problem is by involve ourselves in physical therapy. This is because people with mental illness like depression, schizophrenia, and bipolar disorder often have physical health. So, doing regular exercise is one of the ways for us to contribute in physical therapy. There was a research in 2011 from Helen Laurowski. She suggests that complementary use of a mind-body exercise such as Tai Chi may provide the additional improvement of clinical outcomes in the pharmacological treatment of geriatric depression. Other than Tai Chi, we also can do exercise such as jogging, cycling, and yoga. All of this physical activity may help to enhance our body health. So, let's proceed to the next point. Involve physical therapy to do recreational therapy. This is because, according to the American Therapeutic Recreation Association, recreational therapy or therapeutic recreation is a systematic process that utilizes recreation and other activities as intervention to address the access needs of individuals with illness like psychological and physical health recovery and well-being. For example, we can do arts and crafts to express our feeling through painting or arts so that we can release our stress and pressure in a positive way and also can escape ourselves from the feeling. By this way, we can avoid negative thinking or choices by exploring ways to use time wisely. So that shows how recreational therapy, which one of the example of physical therapy that can help us to deal with mental illness. In conclusion, the ways to deal with mental health problems are by ask for the health professional help like the psychologist or counselor or taking the pharmacological treatment and also involved in physical therapy such as regular exercise and recreational therapy. Remember, mental health is not a destination, but it's a process. It's about how you drive, not where you are going. So love yourself and thank you.